procedures or activities that you as a nurse are supposed to have the knowledge, the skills, and the competency to be able to carry them out each and every day as you go on caring for our patients. So it is very important that we know all these procedures that we have been looking at, because these are important procedures and they're important activities that you will be doing them on a day-to-day basis, meaning that each and every day as you report to work or as you report to your station, the basic nursing procedures are things that you will be involved in carrying out. So today we are going to look at yet another procedure that you are going to be involved in, and that is admission, transfer, and discharge of patients. So I know these terms are not new terms. You've probably heard of a patient being admitted in a hospital, a patient being transferred from one ward to another ward, a patient being discharged from the ward to go home or to go to another rehab facility. So all these are not new terms. But today I want us to look at what these terms mean. Meaning, if we're looking at admission, what do we mean by the term admission? Why do we admit our patients? What do we require to admit our patients? If we're looking at transfer, what does it mean to transfer a patient? Under what conditions do we transfer a patient? What is your role as a nurse in transferring of patients? The same applies to discharge. What does it mean to discharge a patient? What is the purpose or indication of discharging a patient? And what is your role as a nurse whenever you are discharging a patient? So these are some of the things that I want us to look at today. So the learning objectives. By the end of this lesson, you should be able to demonstrate how to orient a new client to the healthcare facility. This patient that you have admitted, how are you going to ensure that they are oriented to the surrounding? Discuss concepts related to caring for the client's clothing and valuable items on admission. How do you go about caring for the valuable of the patients on admission? State some of the nursing considerations related to admission of a client. What are some of the things that you should have in mind whenever you are admitting a patient? So these are just some of the learning objectives that you're supposed to look at. We are supposed to demonstrate the ability to transfer a client from one unit to another safely and effectively. Are you able to do that? Do you have the knowledge? Do you have the skills to transfer this patient from this unit to another unit? We look at that. Identify nursing considerations related to a client's discharge from the healthcare facility. What are some of the things that you should have in mind whenever you are discharging this patient from the healthcare facility? There are certain considerations that you should have in mind when you're discharging this patient. We look at that. You are supposed to explain teaching that should occur at the time of a client's discharge. This patient has been admitted in your facility. They have been there for quite a while. As you are discharging them to go home, what are some of the teachings that you should inform this patient so that he or she should know that as they are going home, these are what they should have in place? So I think we're all on the same page in that. Those are the objectives that we're supposed to cover. As I said, we'll start with the term admission. The definition of admission is a process of receiving a new patient to an individual unit or ward of the hospital. I repeat, it is a process of receiving a new patient to an individual unit or ward of the hospital. Hospitalized individuals have many needs and concerns that must be identified, then prioritized for which action must be taken. So basically what we mean here is that That process of admission, when we say that we are admitting a patient, what we mean is that we are receiving a new patient in a ward of a hospital. We are retaining that patient in that ward. That patient will not be treated and go home. Instead, they will stay in the hospital to continue with the treatment. That is what we mean by admission. So when we say that you are admitting a patient, it means that you are retaining that patient so that the patient can continue to get more care. So what is the purpose of admission, or why should we admit a patient? Why not just treat and let go of the patient? We want to admit a patient to help the patient to adjust to hospital environment and routines. Remember, this is a patient that we want them to, the care extends for a longer period of time. They need a longer period of time to recover, and as a result, you want to admit that patient so that they are able to adjust to the hospital environment and routines that will be involved in their management. We want to alleviate the patient's fear and worry about the hospitalization. So this process of admission, as you are carrying out this process of admission, remember, you want to alleviate the patient's fear. You will agree with me that each and every one of us is scared of being admitted. Whenever you are told that now your condition needs admission, you get scared. You are thinking of all sorts of things. You are thinking that this is something incurable. You are thinking about finances, maybe. You are thinking about a lot of things. There is that fear and anxiety. So as a nurse, you have to recognize this fear in the patient. You have to recognize the anxiety of the patient. So as you are going through the process of admission, make sure that you alleviate the patient's fear and worry. You want to facilitate recovery of the patient from his or her problems. As I said, the problems of the patient might require a longer duration of treatment. So the purpose of admission is to facilitate recovery of the patient from his or her problems. So what are your responsibilities during admission of a patient? As in, you might think that admission of a patient is just a matter of telling the patient that you're not going home. You are supposed to stay in this hospital. But there are a lot of responsibilities that you as a nurse are supposed to have whenever you are admitting a patient. Let me just take you through the process, as in what usually happens. You know, what usually happens is you go to the hospital. You go to the hospital, maybe you meet a nurse there. The nurse checks your vitals. They check what are they take your history, that is. You have done history taking. So the nurses takes your history and assesses you. Then they send you to a doctor. The doctor also assesses you, takes your history and does an assessment. From the assessment, they come to a conclusion that because of the condition that you have, you are supposed to be admitted. So after the doctor has checked and ordered the admission, there are certain things that have to be carried out. And remember, from your assessment as a nurse, there are certain issues that you had written down that this patient needs. So your responsibility during this process is to check for the orders of admission. What does this patient need for the admission? And you carry them out. Check about financial issue, payment scheme, free or paying. In most cases, you might think that you just tell the patient is for admission. And the several cases we've found that you tell a patient that they're supposed to be admitted and the patient refuses. Some of them refuse because of their financial issues. So it is you as a nurse to assess this patient, know what their worries are. Is it the fear of the finances? And come up with a way in which to help that patient. Meaning that the patient might really be very sick, but they do not have money for admission. By the end of the day, we should agree that this might not be your hospital, and there are policies involved in every hospital. So you cannot just say, my code of ethics says that I should not discriminate the patient, so I'll just treat the patient for free. That is not up to you to decide. But what are some of the ways that you can help this patient? That amekwambia hana pesa. Does it mean you just admit the patient, alafu utamlipia? Or what do you go about? So you can come up, your responsibility is to come up with a way or a solution that will help the patient. You can manage the immediate problems of the patient and then transfer or refer the patient to another facility that can, the patient, or a government facility. If you're in a private facility and their government facilities are free, then you can refer the patient to a government facility after you have managed the immediate problems of the patient. You want to assess the patient's immediate need and take action to meet them. As you are taking your history, as you are admitting this patient, there are some needs that are very immediate. You cannot go through a process of admission and the patient is in very severe pain. Even the history might not take place effectively if the patient is in severe pain. So in such a case, do something to relieve the pain of the patient so that the patient will be a bit calm and he or she will be able to give you the correct history. So your responsibility during admission of a patient, I repeat, is to check for orders of admission and carry them out, to check about financial issue or payment scheme, and look for the best way in which you can help this patient. Assess the patient's immediate need and take action. If the immediate need is that the patient has a temperature of 41, do not wait to carry out other processes like giving the patient a bed, etc., and the patient has a very high temperature. First, settle the temperature, then continue. So those are some of the nursing responsibilities that we are supposed to. Other responsibility is to make an introduction and orient the patient. Remember, the patient does not know the hospital. Maybe they have never been in that hospital. And here you are telling them that from today on, you'll be staying in this hospital. So you are supposed to make an introduction, introduce yourself, and orient the patient. Tell the patient, this is where the toilets are, this is your bed. If you want to call for help, this is the bell that you would use. So at least give the patient an idea of what is going on. Greet the patient. Of course, this should come very fast in your assessment of a patient. The first thing you do when you come into contact with the patient is always to greet this patient so that you maintain a rapport with this patient. So greet the patient, introduce yourself to the patient and to the family. Remember, these patients some of them come alone. Others come with their families, and their families are equally stressed about the situation. So it is important that you inform the family that your patient has this condition. The patient we will require to retain the patient for quite a while. These are the times that you can visit this patient, the visiting hours. So at least introduce the patient and inform the patient, the family members about the regulations of that hospital. Meaning, let the family members see where you're going to keep that patient, the bed of the patient, or the room of the patient. Let the family know what time they're allowed to visit the patient. Or if a family member is needed to stay with the patient, let them know. Explain what will occur during the admission process. Tell them what are the processes. This is what we are going to do. Explain to the relatives and to the patient so that they're able to understand that. Orient the patient to the individual units. Remember, this patient does not know that hospital. So, ukimweka in that bed, tell them this is your bed that will be staying. When you need to go to the bathroom, this is where the bathroom is. When you need to switch on the lights, this is how we switch on the lights. When you need something, this is what you can do to call for help, etc., etc. Orient the patient to the entire unit. Meaning the nurses, these are the nurses in this ward that will be helping you. You orient the patient, you tell them the names of those nurses and what their role will be to the patient. It is also important to orient the patient with the other patients. If it is a big ward whereby the beds are just there, lying bed 1, 2, 3, it is important to just tell the patient about the names of the other patient, not about their diagnosis, just the name. You can just do like this: welcome to this ward, patient so and so. This is the bed that you will be staying as we manage you. These are our nurses, nurse so and so, nurse so and so, and nurse so and so. They will be involved in your management. On the bed next to you, there's so and so. The bed after that, just tell them the names of the other patient. It is important. Why? It even makes the patients feel free. And another thing, it reduces the anxiety of the patient. Remember, being told that you're being admitted in a hospital is not a small thing. So patients are worried. They're anxious. So when you orient and they're able to see the other patients, then they know that it is something that is common and you are able to alleviate their fears. Explain anything you expect a patient to do in detail. If there is anything that the patient was supposed to know, explain to them what they're supposed to do. Introduce other staff and roommates. We've talked about that. Perform a baseline assessment. Remember, you are the nurse in the ward. This patient did not come from home direct to your ward. The patient came from home, went to the outpatient department. They were seen by a nurse there. They were seen by a doctor there. Assessment was done there until they were being seen as fit for admission. Then this patient was brought by a nurse now to your ward. If it is a female, maybe to the female ward. If it is a male, then to the male ward. So we are assuming now we are the nurses in the wards. You have received these patients for admission. Do not say that the history of this patient was done in outpatient, so I will not do the history. No. You are supposed to perform your baseline assessment. Ile wakati mimi nilipomreceive huyu patient alikuwa vipi. Do not rely on the information of the outpatient department. Every time when you are caring for a patient, do your own assessment. Could be when the patient came from the outpatient, maybe the temperature was 41. But as you are receiving this patient, what is the temperature now? Iko 42 ama imeshuka to 39. So perform a baseline assessment. This baseline assessment is the same that you have looked at. Do a comprehensive history. Take a comprehensive history of the patient. I'm talking about the baseline assessment. It means you take a comprehensive history of the patient. You do a physical examination of the patient. And you take the vital signs of the patient. That is the temperature of the patient, the pulse of the patient, the respiration of the patient, and the blood pressure of the patient. Why is this important? It is very important for you as a nurse in the ward to do these baseline assessments because these now will make a point of reference. When you see this patient tomorrow, how do you gauge if the patient is improving or worsening? It will be on comparison with your baseline assessment. If on the date of admission, the patient had a temperature of 40 degrees Celsius, day 2, the temperature is 36, you know that the patient is improving. If on day 1, the patient had a respiration of 28, and day 2 respirations are 18, you know that the patient is improving. So the importance of this baseline assessment is so that you can have a point of reference, some baseline reference points in which you'll be able to use to see if the patient is improving or not. I hope we are clear on that. So still on the baseline assessment, so what we are talking about, these are the things that you're supposed to have. We've said you do, among the baseline assessment, you take the history, you do a physical examination, you take the vital signs of the patient, that is the temperature, the pulse, the respiration, the input and output. What has the patient been taking since wafike hospitali, and what is the output? What have they drank? Or if you are given IV fluids in the hospital, how much fluids has been given to the patient? And how much has the patient removed as the output? This is still an important point because you want to continue comparing. If on day one, the output of your patient was 600 mils of urine, day two, the output of your patient is 300 mils of urine. This tells you that your patient is deteriorating. Your patient is now going into kidney failure. But if you had not taken the input-output on the first time, even day two, if the patient has an output of 200, you will not know if this is an improvement from yesterday or it is a worsening of the condition. So it is very important that you check the input and the output of the patient on the first time that you receive this patient. Measure the weight of the patient. This is also another key thing that you're supposed to do so that as the patient is in the ward, you measure the weight of the patient so that you can know what are the dosages that will be given for the patient. Remember, the drug dosages also go with the weight of the patient. Another reason why you want to take the weight of the patient is also to monitor if this patient is gaining or reducing, which can be an indicator of if the patient is also worsening in condition or the patient is improving. You can also take the height of the patient because if you've taken the weight and the height, it is very important you're able to calculate the basic BMI, you're able to take the basic metabolic index of the patient, which will be an indicator of if the patient is healthy or not. Interview the patient and take nursing history to determine the patient's condition. So all these are your responsibilities as a nurse. These are the things that you're supposed to do whenever you are admitting the patient. And we have seen the reason why you do all this is so that you have a profile of the patient. And this is the profile that you will use to see if the patient, to see or to monitor the way the patient is doing. Is the patient improving or is the patient worsening? The patient's personal property items that are not needed can be sent home with family members. Ukishamaliza hizo vitu zote, you have taken the history of the patient. Remember, you will receive this patient from the nurse in outpatient. Let me just go through the process. The patient came from home, they came to the outpatient, they were seen by a nurse there, they were seen by the doctor there, and they were told that they're supposed to be admitted. The patient was escorted together with the family and a nurse to your ward. You are now the nurse in the ward. When you receive the patient from the nurse, you will take a brief report of what has happened in the outpatient department. Patient alikuja saa ngapi na alifanyiwa nini outpatient. Now, you will also do your baseline assessment. You will take the comprehensive history again. You will do a full head-to-toe examination. You will take the vitals of the patient, that is the temperature, the pulse, the respirations, the BP, etc., etc. You will check, you will monitor the input and the output. We have said that, you will do that. You will take the weight of the patient. You will take the height of the patient. Then you will take the personal items. Remember, in most cases, you find that if you're admitted, you have to be given a uniform of the hospital. So give the patient a uniform. Of course, you had given the patient the uniform when you're doing the physical examination. When you're doing the physical examination, the patient removes the clothes that they came with and they put on a hospital gown. So you are supposed to, whatever the patient came with from home, their home clothes, if they have anything valuable, maybe they have something like gold earrings or something that they think that it might not be necessary for them in the hospital, they can remove them and you label them well and then you give it to the family to go home with, because the patient might not be needing them there. Or in some cases, some patients will tell you that they want them to be kept in the hospital until the day that they are going home. You can label them well and keep them for the patient. Other important items can be kept at bedside or should be put in safe place by cabling with patient's name, by labeling with patient's name. So anything that the patient maybe has and they will need should be labeled and put to the patient. What they might not need, they can go home with the patient's relatives. Documentation. All these things that we have been doing, please make sure that you document. Whatever was not documented was not done. Waweza fanya vitu nyingi, lakini if you don't document, there is no proof that that is what you have done. So everything that you did from the beginning, document. Record all parts of the admission process. Everything that happened from the first to the last, you have to record that. Of course, we have what we refer to as the nursing codex. That is the sheet that you can record everything that has been happening, the history of the patient, your findings of the physical examination, your findings of the input-output chart, etc., etc. Notify the dietary departments. Now you have done your baseline assessment. Umeshafanya history. Umeshafanya physical examination. Umechukua vital signs of the patient. Patient amebadilisha nguo. You have given the patient a bed. You have oriented the patient. You've shown the patient where the toilet is, where the bathroom is, where is the bell to call for help. You have oriented the patient with the other patients and the nurses. If you have done all of that, notify the nutrition department or the kitchen that I have received a patient. Her name is so-and-so. She is diabetic, just an example. And because she's diabetic, the food that you should be bringing for her, please bring for her food that has no sugar, low salt, and a lot of fiber. So you give out the requirement, the nutritional requirement of the patient. Don't just say that kuna patient amekuja mleteni chakula. It is you as the nurse, from the assessment that you have done, you know what are the dietary needs of the patient. So as you call the kitchen, you call them with specifics or with specific diet that is tailor-made for that patient or for the individual needs of that patient. If your patient is hypertensive, then you would want to get a low salt diet. You want to get a low fat diet. You want to get enough nutrients, etc., etc. So start Cardex card and medication records. After the patient has settled in the bed, you have informed the kitchen department, then you have document everything that had been done. Andika kila kitu, uweke medication records zake ready. If there is specific form to the facility, complete it. Some hospitals, whenever you are being admitted, there are forms that you're supposed to fill. So make sure that you also fill those forms. So that will depend on each hospital and their policies. I don't know if there are any questions until there. Should I continue? Hello? Okay, Mohammed is telling me I continue. Okay, everyone is saying that we continue. So I hope we have all understood what we mean by the term admission. We have understood why do we admit patients, what is the purpose of admitting of a patient. We have understood our responsibilities during the admission process. Types of admission: emergency admission, routine admission, and transfer from one ward to another. Let us start with the emergency admission. Clients are admitted in acute conditions requiring immediate treatments. These are patients that they are admitted during the time of admission, they're in a very acute condition. Sorry about that. So, example are patients with a heart attack, accidents, poisoning, etc., etc. So, you find that for such a case, what is important is to stabilize this patient. Of course, you will do all the other processes, but it might not be logical for you to start introducing this client to the other patients in the ward and the patient is in acute condition. No. This is a patient first you stabilize. You take care of the immediate problems. You stabilize the patient. After the patient is stabilized, then even the history that you take first, you take a very quick history and you do a quick head-to-toe examination that will just help you to stabilize the patient. After the patient is stable enough, then you can sit down with the patient and now take a comprehensive history. You can now do a head-to-toe examination. If the patient is stable enough, you can now orient to the other patients. You can orient to the... So you will do everything, but the order of priority has to change when you're dealing with an emergency. A patient who has had an accident, they are bleeding profusely. You might need to control that bleeding first before you sit down and do a head-to-toe examination. So basically, that is the difference with emergency admission and routine admission. In emergency admission, you need to take care of the problem first before you continue with the other processes. Routine admission are the normal ones that we do. Clients are admitted for investigations and blood treatments and surgeries. These are patients that amekuja, they are stable, they are just admitted so that they can continue with treatment and investigation. So this one, you can follow the procedure, you can take the history, do a physical examination, take the vitals, take the weight, the height, let them change into a gown, identify a bed, orient them to the hospital, to the nurses, to the clients. This is a routine admission, the one we have been talking about. And then there's transfer from one ward to another. This is where by now you are admitting a patient, but the patient has been in the hospital. Maybe the patient was in the medical ward. But now the patient has been transferred to now the surgical ward. As the nurse in the surgical ward, you will be now admitting that patient in your ward. So the patient might have been in the hospital, but has been transferred from one ward to the other ward. So as you are admitting that patient from a certain ward to now your ward, you might also need, some things might not be done comprehensive because things like history taken and physical examination, maybe they were done comprehensively, but you need to now take a briefly yours. It might not be as thorough as the routine admission because most of the things had been done as the patient was in the other ward. Any questions until there? So why would you need to transfer a patient to another ward? There are several reasons that you'd want to transfer that patient to another ward. Maybe the treatment, maybe the condition that they have has changed. Like if the patient was in the medical ward and somehow they developed something like an abscess and they were taken to theater, you can no longer keep that patient in the medical ward. The patient will have to go to the surgical ward. So transfer of patients is a very common thing. It happens. And it is done for several reasons, as we've said. Maybe there is a change of management from medical now to surgical management. Sometimes maybe it could be for the patient's own request. Maybe the patient was in a general ward and they want a private ward. So that is now the request of the patient. Others, it can be for purposes to do with the condition of the patient. Like now, maybe the patient has developed a condition that you need to isolate. patient has, let's say, something like bacterial meningitis, which is highly contagious, you need to isolate the patient. So those are some of the reasons that you can transfer the patient to another unit. So what is the procedure? Explain the transfer to the client and the family. Usianuke tu siku moja asubuhi ukasema leo unaenda hospitali, leo unaenda ward nyingine. The patient does not know. It is wrong. Explain the transfer to the client and the patient. Tell them that because of this that has come up, because of this condition, the way it has changed, it is important that now we transfer you to another ward, to the surgical ward. And you inform the family too. You can imagine the anxiety the family will have if they come visiting to your ward and they come to the bed that they know their patient was there and they don't find him. The first thing they will think is that their patient has died. So you can create a lot of havoc. So it is always important that you explain the transfer to the client and to the family. Assemble all the client's personal belongings, charts, X-ray films, lab reports, double check for all other clothes and materials. Remember, during the process of admission, we had collected all the patient's belongings. Tulimvalisha uniform ya hospitali, nguo zake na vitu zake zote, tukazilabel, tukazieka. So when you are transferring the patient, you transfer na vitu zake. Asiende ward nyingine alafu akawa aliacha nguo zake in your ward. The charts, all the investigations that you had done and their reports, let them go with the patient because they will also assist the medics or the nurses and the doctors in the other facility, in the facility where the patient has been transferred, to know what has been done and what is yet to be done. Determine how the client is moved. Huyu client atatembea. Remember, the patient is still sick. Atatembea, ataenda na wheelchair, ataenda na stretcher. It is important that you know all those. All those you have to put in place how the patient will move from one point to another point. Provide for the client's safety. Take measures to accommodate IV bottle, drains, and catheters. Protect the client from draft and cover the client with a blanket for warmth and pressure. As the patient is being transferred from one point to another point, make sure that they are safe. Make sure that if they have a catheter, if they have IV lines, they are well accommodated in that wakati wa kusafirishwa catheter isitoke, ama IV fluids zisitoke, etc, etc. Somebody is telling me to elaborate on charts and X films. Meaning, remember, transfer means you're taking this patient from this point to another ward. So during the stay when the patient were in ward A, there were some investigations that were done. Maybe the patient had been done some X-rays, some CT scans, etc, etc. Or maybe there were some charts or things like the input-output charts. You are monitoring their input and output. You are monitoring their observations, the temperature, pulse, respiration. Remember, when you monitor, you record them somewhere. So we record them on the charts of the patients. So as you are transferring this patient, let the patient be transferred with those investigations that had been done in the ward. Those X-ray films, those charts, let them go with the patient so that even as they go to ward B, hiyo B watajua huyu patient alikuwa ameshafanywa X-ray na hii ndo majibu yake. So I hope I've explained that. Collect all the client's medication, IV bags, tube feedings, and so forth. The medication that the patient was using in your ward, let them go with the patient. It is when they reach there, the nurse who is admitting them in ward B now will look at those medication again and will see the ones which the patient will continue with and the ones which they will not continue with. Check the Codex or medication administration code record for accuracy. The Codex is the chart that you record everything about the client. Everything about the clients that you as the nurse have done is recorded on the Codex. So make sure as you are releasing the patient from your ward to another ward, that you have documented on the Codex. And make sure if you are the nurse who is receiving this patient from another ward, you check the Codex that has been Somebody was asking about the IV bags and tube feedings. Whenever you are transferring this patient, IV bags ni kama zile intravenous bags. If you give the patient was on IV fluids, kama alikuwa kwa saline, alikuwa kwa dextrose, wasa to another word lazima aende nazo. So that is what we mean by IV bags. Another was asking, and CADEX, I said, no, CADEX is the form that we as nurses document everything that we have done on the patient. And it is different from a medication administration record. A medication administration record is a treatment sheet. It is just a record that shows patient has been given this treatment at this particular time. So there are two things, but all of them should go with the patient. So let us continue. Record the transfer in a transfer note, give the time, the unit to which the transfer occurs, types of transportation, and the client's physical and psychological condition. So all these can be recorded in the CADEX, or you can have a note, transfer note, that will record everything about that patient, so that will a patient akifika point B, the nurse will read and they will also have an idea of what transpired. Make sure that the receiving unit is ready. It is usually important that you call that ward. If you are in ward A and you're transferring a patient to ward B, call and tell them, we have a patient that we're transferring to your ward. Please make arrangements. Why? Because some of these patients, maybe you are transferring to the patient has worsened in their condition. You are transferring them from your ward to the ICU. In the ICU, there are several machines. Some of them need some time for them to be on. They need oxygen. So there are so many preparations that have to be made before the patient is accepted. So if you don't make these preparations earlier, the patient might reach there and find that that ward is not ready. So it is always important that you make a call to the receiving department and tell them, we have a patient that we want to transfer to your ward because of this and this and this. And if there are any special needs of the patient, you inform them way ahead. So I think you're together on there. So this is a picture of a nurse transferring a patient. This is a stable patient, so maybe I transfer you in a wheelchair. But if the patient is a person who has worsened in condition, you might need to transfer with something like a stretcher, not a wheelchair. So it depends on the condition of the patient. It will guide you on the mode of transferring that patient. Somebody asking what are the reasons for transferring a patient? Remember, we have said you might need to transfer the patient based on the condition of the patient. If you are in a general ward and the patient has worsened in condition, you transfer for specialized management. You might need to transfer to ICU so that they can get specialized management. Or you transfer because maybe this particular ward does not have a dialysis machine, and the patient needs a specific dialysis machine, so you can transfer to the renal unit. So the patients are transferred for different purposes. Could be you're in an ICU and the patient has improved, so you transfer so that the patient can be in a general ward. So Emmanuel Tsuma, I think I'm answering your questions. There are so many reasons why you need to transfer a patient. Basically, to continue to get specialized care, or maybe depending on the condition of the patient, you can transfer to a specialized unit. So discharging a patient. Somebody is telling me, Perpetual Ndogo is asking, is it the same when you transfer to another hospital? We should understand two terms. There is transfer and refer. So maybe before we finish, I'll talk about referral and we'll be able to understand those two terms. Discharging a patient. Why do we discharge a patient? Because the patient condition has improved, the progress is good, because there is no change in the patient's condition, the patient has not improved, and so we discharge from our facility, but we refer to another hospital. Remember, hapa, could discharge a patient does not mean the patient is healed completely. That is just one indication for discharge. It is just one indication for discharge. Could be that the patient has improved, or the patient problem has, then you discharge to go home. That is, you can also discharge when the patient, there is no change in the condition of the patient. So in this case, you are not discharging to go home, but you discharge from this facility so that the patient can go to another specialized facility or referral. Maybe you don't have a theater here, you don't have an ICU, you are taking the patient to Coast General because there is an ICU so that the patient can be managed there for further management, that is. And you can also discharge against medical advice. Patient mwenyewe amekwambia mimi sitaki kujua nimepona ama bado nataka kwenda nyumbani. You have no, in that case, you can just discharge the patient against medical advice. You cannot keep the patient in the hospital kama hataki, but you discharge against medical advice. And in the case of death, then you also discharge the patient. So those are some of the indications for discharging a patient. So what are your responsibilities during the discharge of a patient? Check for orders that a patient needs to be discharged. Remember, you don't just wake up one day and decide this patient is going home. That patient, it means that you, as you are nursing this patient, you are monitoring that patient, and you have monitored the progress of the patient for a while. You have monitored the progress of the patient for a while, and you have come to the conclusion that this patient is improving. The doctor who is also monitoring that patient, you have informed them that this patient is improving. They have come, they have seen their patient, and they have agreed that the patient needs to go home because their needs have been met. And the doctor now writes that this patient will be discharged. Now, you cannot discharge a patient if they have no orders of discharge. So your responsibility is to make sure that those orders are there and you discharge them. Plan for continuing care of the patient. Even as you are discharging this patient, it is important that you plan for the patient as they go home. What are some of the things that they will do? Ataendelea kufanya nini akiwa nyumbani? Atakunywa dawa gani? Atakula chakula gani? What are the instructions that you give this patient during discharge? Very important. Don't just tell the patient sasa uko tayari kwenda nyumbani nini. No. If you do, this patient will come today is sick again. You can imagine if the patient was being admitted because of diabetes and you have stabilized the blood sugars and you are discharging the patient home without telling him or her the kinds of foods that they're supposed to eat, the kind of medication that they're supposed to continue with. This patient will just go home and come back to the hospital in a worse condition than they went. So it is very important that you inform the patient what is the continued care they will have to do at home. Referral as necessary. If you are discharging the patient, go to another hospital. Make sure that they have a referral note. A note that is telling them that the patient has been referred from hospital A to hospital B because of these reasons. Give information for a person involved in the patient care. When you are discharging this patient, remember the patient is going home to stay with family. So make sure that the patient, the families are, of what are some of the things that they should do at home to help the patient. Has been discharged. Facilitate transportation responsible unit. Patient and ensure there is an ambulance that will help the patient that will help the patient. So doctor is asking if it is nice to discharge the patient with the doctor. Remember, as nurses, we stay with these patients for the longest time. So you as a nurse are responsible for the care of this patient. So it is you to inform the doctor of the sorry. So based on the information that you have given, it's something callable based on the information that you have given about the patient. The doctor will also assess the patient, and it is the doctor who will decide on the discharge, who will write on the discharge. The documentation is written by the doctor. But remember, it is you who knows the patient, so it is you to advise that this patient, that tell this patient on this date, from the day the patient was admitted, this is how the patient has been progressing. I think based on the way the patient is today, the vital the pressure has stabilized, the blood pressure is also okay, the pulse is fine, and the patient, their SpO2 is also okay. I think this patient is fit to be discharged. So you have basically informed the doctor on the progress of the patient. It is the doctor now who will now discharge the patient, and you will continue with that. You will carry out the discharge instructions. The doctors, I think, have answered you. Facilitate transport to the responsible unit. Come attend an ambulance, meaning you have to facilitate that. Somebody is asking, what if the family members demand referral of the patient? Remember, when you look at the rights of a patient, the patient has a right to refuse care. So patient wakikuja wakwambia mimi sitaki kukaa hii hospitali naenda kwingine, there's not much you can do. Let them against medical. These are the instructions that you're supposed to tell the patient during discharge. I hope tuko pamoja sasa. So as you are discharging a patient, you explain to the patient what to expect about. Violet is asking if discharge means to discharge to go home or another hospital. You can discharge to go home, you can discharge to go to another facility, but if you are going to another facility, it is to refer. But even as you are referring a patient, you still discharge from this hospital and you refer to another hospital. So what are you supposed to teach the patient when you're discharging the patient? Teach them about what to expect about the disease. E.g., ulipokuja, you came, we admitted you because of malaria, we have treated you for malaria, and now you do not have malaria. But it is important to note that malaria is a condition that can come back. So as you go home, make sure that you sleep under a treated net. Make sure that you get rid of the bushes around your home. If it is something like the patient had been admitted because of diabetes, tell them, this is a chronic condition. It does not mean that now you do not have diabetes. You are still diabetic, but you should be able to manage it using these medications that we are given. You tell them everything about diabetes. What is diabetes? What are the signs and symptoms of diabetes? How will they know that their blood sugars are high or they're low? Explain to them about the disease. So explain to them about the disease that they have. Explain to them about the medications. Come on, you are discharging them with medications. Explain to them what time they're supposed to take the medication, what doses they're supposed to take the medication, and what are those medications for. Explain to them about activities. E.g., Yes, because you are diabetic, it is very important that you do exercises. But at the same time, do not carry out very vigorous activities because you might end up hurting yourself, and wounds of a diabetic patient take a long time to heal or might cause complications. So explain to the patient what they can do, what they cannot do. Diet. Explain to the patient what foods they're supposed to take, what they're supposed to avoid. Need for continued health supervision and others as needed. Explain to them, tarehe ya kurudi clinic ni lini? Anarudi wapi? Kwa sababu gani? You continue explaining to them. So those are some of the things that you're supposed to inform the patient. Inform them about the disease. Kama alikuwa ameadmitiwa na hypertension, tell them what hypertension is, what are the signs and symptoms of hypertension, what are the signs of complications, what can happen, what are the medications that they're supposed to take, why do they take those medications, what are the activities that they're supposed to carry out, what they should avoid, what is the diet that they should take, what they should avoid, why are they supposed to come for clinics, see. Do a final assessment of physical and emotional status of the patient and the ability to continue with their own care. Usimtoe tu hivyo, assess them, do a physical examination, emotional status, is the patient ready to go home? Like somebody saying there's some patients who don't want to be discharged. So you will do this assessment. If you find that the patient is not emotionally stable and you think that they're fit to go home, you just cancel the patient. You tell them you are now healed. Whatever is remaining, you can do it at home, and that is why we are giving these medications. When you explain to the patient agree. Check and return all patients' personal property. Kumbuka pale ulipokuwa unamadmit, ulichukua vitu zake, ukazilabel, ukaziweka mahali. As they are going home, you don't discharge them with the hospital gown. You take your hospital gown, you give them their personal property. That is what they will use to go home with. Help the patient or family to deal with business, office for customary financial matters, and in obtaining supplies. Help the patient or family to deal with business, meaning that if this is a patient who is going back home and they were supposed to do certain things, or they're supposed to settle the bill, explain them the processes of the hospital, how they're supposed to settle the bill, etc. Keep records. This patient, there's a certain book that you're supposed to write. This patient was admitted on this day, you are discharging on this date, the state of the patient during discharge. Write a discharge note, special forms for the facility. So there's something we refer to as Perpetual is asking if you need to do a head-to-toe examination before admitting, even in the case of emergency clients. Remember we said for emergency clients, you deal with the emergency first. After you have stabilized the emergency, you can always do a head-to-toe exam and a comprehensive history, but you deal with the emergency first. Discharge summary is, Faith is asking if the patient is HIV positive and is in a position they might not remember, the code of ethics tells you that you have to make sure you maintain the confidentiality of the patient. And remember, how did you know if the patient is positive if you did not test the patient? You must test to know if he's positive. And you cannot test a patient without the patient knowing that you are testing them. So, Faith, I don't understand what you mean. You cannot test the patient without the patient being aware. You have to cancel and test. So, discharge summaries. So, what does a discharge summary include? Every time you discharge a patient, the patient must have a discharge summary, which includes the description of the client's condition. How was the client during the date of discharge? What was the treatment that had been given? What diet was the patient taking in the hospital? How was the patient's activity level? And are there any restrictions for the patient? All those should be in the discharge summary. Referral. Referral is whereby a patient or client is sent to a higher healthcare system for better diagnostic and therapeutic actions. You only refer when the patient will get better diagnostic and therapeutic actions. So you refer upwards. Awezi toka Coast General refer to another dispensary. You come from a dispensary to a district hospital, to a provincial hospital, and to a national hospital. You always refer upwards. So you are referring so that the patient can get better diagnostic and therapeutic actions. So you refer when there's any active health problems, you inform them about their current medications, their current treatments, or their eating and sleeping habits. So that is just a picture telling us about referrals. So whenever you're referring, you should also have in mind what are the abilities that the patients have. What are the self-care abilities? What are the support networks, the lifestyle patterns, and the religious preferences? You should know all this as you are referring a patient, so that the patient, as the patient goes there, they are able to be assisted. Discharging a patient against medical advice. Remember, sometimes a patient will tell you they want to go home, and you know hawajapona. Unajua hawajapona na anataka kwenda home. In such a scenario, you discharge the patient against medical advice. This is when the patient wants to leave an agency without the permission of the physician or nurse in charge. Ascertain why the patient wants to leave the hospital. Muulize kwa nini anataka kwenda. Notify the physician or nurse in charge of the client's decision. Offer the patient the appropriate form. Let them sign. Alikuwa yeye mwenyewe ndo ametaka kwenda. Hajakuwa discharge, but ni yeye mwenyewe ndo ametaka kwenda. If the client refuses to sign the form, document the fact on the form and have another health professional witness. Provide the patient with the original of the signed form and place a copy in the record. When the patient leaves the agency, notify the physician, nurse in charge, and agency administration as appropriate. Assist the patient to leave as if this were a usual discharge from the agency. So what is important to note is that if the patient is being discharged against medical advice, have proof. Kwa yeye mwenyewe ndo alitaka kudischargiwa, ndo maana akasign. Usimwache tu atoke hivyo hivyo. And that basically brings us to the end of admission, discharge, and transfers. Any questions?
Wow.
You can note, Emmanuel.